Good morning. This lecture is on clinical implication of alginate impression material. We all know that impression is a negative likeness or copy in reverse of the surface of an object and imprint of the teeth and adjacent structure for use in dentistry. For making any kind of dental processes, we need to use some impression material. It may be a hydrocolloid or it may be elastomeric impression material or it may be a rigid impression material. Alginate is a irreversible hydrocolloid impression material, most commonly used impression material in dentistry. For making alginate impression, we need to mix the powder with water, then load the alginate material into the tray. Mainly rim lock tray is preferred. Once it is loaded, we have to place the tray in the patient's mouth. Make sure that the center of the tray is coincide with the midline. Then we have to support the tray till the material sets. Once the material reaches the gel stage, we have to remove the tray in a single stir. Then we have to wash the impression under running warm water, running tap water, so that debris and saliva will be washed out of this impression. Then we have to disinfect. How to evaluate alginate impression? The alginate impression should show the anatomical area, including retromolar area in mandible. The tray should be center. Then the impression should be clear. There should not be any voids or air bubbles. There should not be any breakage. The peripheral roll should be seen. We have to rinse the impression under running tap water. Then we have to disinfect it. Then we have to store the material in a sealed plastic bag. The properties are it has no taste and odor. It is a flexible material. It's recovered 97.3%. It reproduces the details. It is densely unstable material. It has less strength. The shelf life is 1 month at 65 degrees centigrade. There are so many failures encountered with alginate impression like grainy mix, separation of the tray and the syringe material, tearing, voids, rough or chalky cause, distortion. Let's see the cause for each failure. Grainy mix. This is due to improper water powder ratio. Voids in the impression. This is again due to poor mix or entrapment of air during mixing. If you are not using a figure of 8 moles, it leads to voids. Tearing. If again the water powder ratio is not proper, too thin or thick mix leads to tearing. Early removal of the tray leads to tearing of the material. Inadequate bulk also lead to tearing. Separation of tray and impression. When before going to make impression, we are supposed to shake the tray to remove the water. If the water layer is there, that leads to separation of the tray and the impression. Rough or chalky cause. This is mainly due to poor mix of alginate or incompatibility between the alginate or gypsum product. If the saliva is not uh, washed out, that also leads to rough or chalky cause. Distortion. Distortion is due to delay in pouring of the alginate impression. We need to pour the alginate impressions to avoid distortion before 12 minutes. Also, premature removal of the tray from the patient's mouth leads to distortion of the impression. After removal, we have to handle the impression very carefully because it's a hydrocolloid material. To prevent cross-contamination, we need to disinfect with 2% glyceraldehyde or 10% iodophone or 5.25% sodium hypochlorite. The surface can be hardened by placing it in or immersion in 2% potassium sulfate in 100% relative humidity. As it is a hydrophilic material, it is compatible with gypsum product. Let's see the clinical implication. Alginate is mainly used for duplication costs, for making impression for maxillofacial processes, impression for orthodontic purpose, impression for mouth guards, impression for professional restoration, for making diagnostic impression for complete denture, for impressions for removable partial denture. Further details, you can refer the following textbooks. Thank you.